Good afternoon, everyone. Thank you for being here. My name is Owen Ryan. I'm the Executive Director of the International AIDS Society. This is my 4th week on the job as the Executive Director, and I am humbled to have spent this week with my colleagues here at the table. This has been an extraordinary week, and it is one that has really reaffirmed why I personally am so committed to HIV. So I have a great pleasure this afternoon of introducing our 6 speakers who are next to me. They'll briefly discuss their comments for this afternoon's closing session, and then we'll have a short period for question and answer for them. For the question and answer period, if you could stand to the microphone and clearly say your name and the media outlet you're from. We'll have a few minutes left at the end there. So I will turn this over to my esteemed colleague, who everyone knows sitting next to me, who has the best sartorial style of anyone I know. Professor Sharon Lewin is Director of the Infectious Diseases Unit at the Alfred Hospital, Professor of Medicine at Monash University, and co-head of the Center for Biomedical Research at Melbourne's Burnet Institute. Professor Lewin is the local co-chair of AIDS 2014. She will briefly discuss now some of the highlights from the conference.
Thank you, Owen. I start by saying, as the local co-chair, we're absolutely delighted with the conference. We've had over 13,600 participants, exceeded expectations significantly, and more importantly, over 6,000 non-delegates to the Global Village, meaning that the City of Melbourne will really learn so much around what the HIV response is all about. We obviously started with a very difficult beginning with the news of MH17, but in many ways I feel that has united the HIV community even more with a sort of renewed sense of how important the work we're doing is currently. I think over the week we've obviously heard some very good news stories of great successes in the HIV response, reduction in new infections, reduction in AIDS-related deaths, 14 million people on treatment. But we've learned about how much more needs to be done, and we've learned that one size doesn't fit all, that there are enormous variations in the epidemic with geographical hotspots in key affected populations, and we need to target our interventions to have the biggest effect. We've heard lots around prevention, new moves in pre-exposure prophylaxis, new ways of delivering PrEP, but there's a lot of operational issues in understanding, again, the epidemic and how best to implement prevention strategies. I think a key theme of the conference has been around stigma and discrimination, and no one summarised that better than Michael Kirby at the beginning, saying that we need to applaud and support those brave members of key affected populations that have stood up in countries like Russia, Uganda and Nigeria, many of whom have visited here. And we, as a global community, we need to make sure that they're supported in every way. Finally, as a scientist, I've obviously been very interested in the new science, particularly around cure and vaccine research. I think the field is moving ahead rapidly. I think we've learnt that remission is probably a better term to use than cure. We do know that we can induce remission. We learned that from the Mississippi Baby, but we now need to work to understand how that was done and how to extend the time that someone can safely stop antiretroviral therapy. And finally, for me, this conference is all around the legacy, what will continue beyond 5 days in Melbourne. And I'm particularly proud of the AIDS 2014 legacy statement that was issued by all the states and territory ministries of health to commit Australia to the virtual elimination of new infections by 2020. A very bold statement, and one that will totally energise what we do here in this country. Thank you.
Thank you, Professor Lewin. I next have the pleasure of introducing who I will now call the world's mayor, who has really raised the bar on local government participation in the conference. Lord Mayor Robert Doyle has been in his current office since November 2008. He was previously member for Malvern in the Legislative Assembly of Victoria from 1992 to 2006, and leader of the Victorian opposition from 2002 to 2006, representing the Liberal Party of Australia. The Lord Mayor will briefly reflect on what the legacy of AIDS 2014 is for Melbourne.
Thank you, Owen. First, for me, some of the scientific and research announcements, as Sharon has alluded to, very exciting for the future of treatment. Secondly, the other point that Sharon made about elimination of stigma, and not just the legacy statement, but also the Melbourne Declaration. I'm very proud of that Melbourne Declaration, carrying the name of our city and the slogan that nobody should be left behind. And that's particularly important for our city. You might not know it as you go around, but we come from 200 different nations. We speak more than 220 different languages and dialects. We practice more than 120 different faiths. But we are one Melbourne, and that's very important to us. So that's the second part. The third part, and I'll tell you a little story I'm going to tell at the closing ceremony as well. As a city, we have tried to say this is not just another conference. This is something that we embrace as a city, and it's something that we participate in as a city, legacy as well as during the time of the conference. And that's important to us. So we wrapped around 150 cultural events around the conference itself to add to the experience of the delegates. I hope to indelibly stamp Melbourne on their memories, but also to make it very special, to say this is not just about talking in a lecture theatre. This is about engaging a whole city. And I hope that was very successful. I hope you enjoyed the more than 50 iconic buildings that were lit red during the course of the conference, red being the signature colour. And I'll just show you something quickly before I finish what I have to say. I've said to Olive, this should be mandatory for all mayors who host this conference, and certainly the Mayor of Durban needs to pick this up. All week. Not just one day, all week. One reason why is because as you go about and you meet different people and you have different meetings and you're giving different speeches, people do say to you, why the red socks? And it's given me a chance all week to a much wider audience to talk about AIDS 2014. But I'm very proud of my city's reaction during this week, and one little story to tell, no, maybe two little stories to tell you why. First, one of our delegates arrived at Melbourne Airport, of course, and was coming in, was very surprised to find that the taxi driver was very enthusiastic about the conference, knew all about the conference, was delighted to have an international delegate in his taxi, and then offered to give him, for free, a 10-minute tour of Melbourne in his taxi. I thought, we're off to a good start. But the one I really liked is one of our Kenyan delegates. Got here at the start of the conference, of course couldn't sleep, so early in the morning, got out the map of Melbourne and went for a walk. Around about 5:30 or 6 in the morning, found himself down by Flinders Street Station, our iconic railway station. No one else around, and he's standing there with a map in his hand. One of my truck street sweepers, the ones with the big brushes underneath, powers down beside him. The driver pulls up, puts the handbrake on, takes off his headphones and says, "Are you lost, mate? Can I help you? You here for the conference?" I thought, yep, Melbourne, you've done it proud. We've loved having you here, by the way.
Thank you, Lord Mayor. Our next speaker is John Manwaring. John has been living with HIV since 2006 and talking about it ever since. There have been an array of events and sessions on stigma and discrimination at this week's conference, and John is going to speak to those briefly.
Thanks. I don't know necessarily as articulated the last two speakers, but I do want to acknowledge just how remarkable a city Melbourne is, not just for the conference, but just in a general sense for people living with HIV. It's maybe not a slogan you want to use promoting the city, but it is the best place in the world to be HIV positive. You know, I'm from Colorado originally, and coming here, I've never seen, I didn't know it was possible to see such a coordinated, concerted effort to have positive people supported and represented and taken care of. The fact that medication is available widely and without a copay, things like that, simple things, but it means a lot to me as a new permanent resident of Australia, so glad to be here. Yeah, I've been at the conference all week, and I've been trying to just observe and pay attention to everything that's been said, because I think when we live in Western societies, Northern societies, however you want to put that, we have a tendency to forget just how fortunate we are. And I can say not a moment goes by that I don't realize how privileged I am to have some certain, unfortunately, but inbuilt advantages. The fact that I'm a white male is an advantage, and I'm seeing that here, and it's heartbreaking in a way, because it seems like these are rights, and it's just a basic treatment of people that should be afforded to everybody. And so it's been discouraging but also heartening to see the way that people across the world have responded to this, especially in environments that are far worse than here. As Sharon mentioned, Russia, Uganda, Nigeria, even India for that matter. So when I've tried to look at all this and try to understand, all right, what's the unifying principle? What is it that brings us all together as people living with HIV? What can we do to address the epidemic? And I think what it is, it comes down to just being honest, being open about our status. And it's a terrifying thing to do, especially when you're in a place like Nigeria or Uganda, and being open about that could mean something as dire as death. So again, speaking from a position of privilege, it's easy to say, but it doesn't have to be these, for us living with HIV, these broad, bold efforts. It is a simple conversation that we just have people about our experiences, about who we are as people, where we come from, where we're going, what our hopes and dreams are, because it humanizes us. It takes us out of this realm of some fearful and horrifying disease and makes us people. And, well, it doesn't make us people, we are people, but it helps people see that we're just as deserving and just as entitled to dignity as they are. So it's been encouraging to see that, and I think I'll address that a bit better in my speech this afternoon. But I think coming out of it, the key thing I would like to see is, well, something that's been around since longer than I've been around. I'm from, again, Colorado, but 3 months before I was born, we had the Denver Principles come out, and this was, if you're not familiar with them, basically Nothing About Us Without Us, or GIPA, the greater involvement of people with AIDS, or meaningful involvement of people with AIDS, MIPA, the other one. I'd like to see that renewed. It needs to be understood that people living with HIV are not victims, we're not sufferers anymore. We are living full and wonderful lives, and we are active and willing participants in fighting this battle. And we're happy to help in any way, shape, and form, and we need to be made full partners. And so that's what I'm hoping to see going out of this, and I hope to see more of that done in Durban in 2 years.
Thank you, John.
Thanks.
Our next speaker is someone that if you don't know her by now, you're not paying attention. So Professor Françoise Barré-Sinoussi is Director of Regulation of Retroviral Infectious Unit at the Institut Pasteur in Paris, the current president of the International AIDS Society for a few more hours, and therefore my boss for a few more hours, and the International Conference Chair for AIDS 2014. Françoise, please.
Thank you, Owen. Only a few hours for you to suffer. It has been, I think, a great conference. As you know, we started this conference in very deep sadness. After the tragedy, with the loss of colleagues and friends, I found out that finally what we have been going through and showed to me that it's a lot of respect among our communities for all of us. I mean, and when one of us disappears, everybody is concerned. So for me, it has been a conference showing once again how much the community is really united for the same cause, of course, for the fight against HIV/AIDS, but beyond. And my feeling really at that conference is that it's probably the first time that we are opening the field of HIV/AIDS to others. Through co-infection, of course, and it has been several presentations, co-infection, TB, HIV, but TB alone has been mentioned as well. Co-infection, HIV and hepatitis, with presentation on hepatitis, particularly hepatitis C, which is a revolution in the field of hepatitis C with a treatment which is able to cure people infected by hepatitis C. A lot of discussion. The feeling that the HIV community is now ready to fight for access, universal access to HCV treatment, as the community has done and is still doing for universal access to the treatment for HIV. This is certainly a new movement for me of the community that I'm sure will continue in Durban in 2016. I like also to say, because it's what I heard from colleagues, you know, in the conference, saying science is good now again. Science is back at the AIDS conference. It started certainly in Washington, D.C., and I hope that at least partially I've respected myself, the mission that one of the former executive director of the IAS and the Governing Council asked me to do, to try to bring back science to the AIDS conference. And I'm glad also to see very basic scientists coming to me after visiting the Global Village and saying to me, now I understand what you are saying when you are speaking about the HIV/AIDS community, and that makes me to think differently as a basic scientist. That's where we are at the AIDS conference, to make everybody to understand better and to remember for who they are working. I would like to finish by really my thanks to the City of Melbourne, to the Government of Victoria, to the Australian authorities, because it has been really wonderful to work with all of you for 2 years, a lot of support. It's really, you know, Australia has been one of the very first countries to be very strong in the response to HIV, and this is really showing everybody that Australia is continuing for Australia, but not only for Australia. It's for the whole region, and for myself working in collaboration with some countries like Vietnam and Cambodia, I can see very strongly the presence of Australia in those regions. And of course, it has been for me a real pleasure to work with Sharon. I will never repeat that enough. It's really a wonderful lady, a very energetic person, and it's really, Sharon, I hope that we will keep contact after the conference for sure. But now we will have a new president this afternoon, and I wish him good luck, with a smile, as he said. And he's a little bit worried about that, but don't be too worried, Chris. It's also a wonderful experience.
As Françoise has said, I have the pleasure of introducing my new boss and a longtime hero of mine, a person who really epitomizes what the conference is about, bringing together science and human rights as part of one agenda. So Dr. Chris Beyer is Professor of Epidemiology, International Health, and Health Behavior and Society at the Johns Hopkins Bloomberg School of Public Health in Baltimore, Maryland. He serves as Director of Johns Hopkins Training Program in HIV Epidemiology and Prevention Science, and is founding director of the Center for Public Health and Human Rights. He is the president-elect of the International AIDS Society and will take the presidency at the conclusion of the conference today. Chris.
Well, thank you so much, Owen. Good afternoon, everyone. I, too, want to express my deep thanks to the City of Melbourne, to our hosts, to Sharon and Françoise, who are really extraordinary co-chairs. I also want really to acknowledge the Conference Coordinating Committee. For each of the international AIDS conferences, we put together a conference coordinating committee that includes local hosts, people from the government here, a very diverse array of colleagues, community scientists. And having been on several of these in the past, I must say, I think it's something about Australia and Melbourne that this was the most collegial, the most engaged, and certainly under Sharon and Francoise's leadership, the least contentious conference coordinating committee I have ever sat on, and that committee was also the incubator of the Melbourne 2014 Declaration. And I think the Declaration played a very critical role in saying to the world what is the story of the Melbourne AIDS Conference, and that story is about inclusion. It is truly about no one left behind. It's truly about sharing the incredible tradition of both public health, clinical acumen, scientific leadership, and the real engagement and involvement of community at every step of the way that allowed Australia to respond so quickly as HIV emerged, to maintain very low rates of infection in the population, and to really be an example that at this point in history we need more than ever. So I think the whole movement is grateful to Melbourne, grateful to Australia, and we really hope that the Melbourne Declaration is going to be a living document that is going to continue to inform our responses. To me, I'll just very briefly talk about some reflections on the conference and then turn our attention looking forward to Durban in 2016. What I've heard consistently from friends and colleagues is that this is the conference more than anywhere else before where the separations, the silos between scientists, clinicians, providers, people living with HIV, community activists truly went away. We really had unity, as Francoise and Sharon has said, an incredible commitment, a shared commitment to purpose. I think certainly as we dealt with the tragedy of MH17 and began to grapple with it as a community, there was an extraordinary sense of pulling together and of a recommitment of efforts in all of our various disciplines and engagements around HIV, and it really has been powerful. And I want to add the media to that. We had to, of course, do a lot of media. There was a lot of media attention. People were respectful. Your questions were thoughtful and informed. And I'm really not just saying that. As an American, I expected it to be much more challenging. Looking ahead to Durban, so for those of you who, I'm sure many of you are aware, but some may not be, that the International AIDS Conference, the first conference in Africa, was in Durban in 2000. And that was a watershed moment in our movement and an incredibly important conference. And the reason why is because antiviral therapy, the triple cocktail, had been finally developed through the use of many, many clinical trials and research effort. The three-drug cocktail had been identified in 1996, and we had the Lazarus effect. People who were very close to the end of clinical AIDS, getting better, getting up out of bed, going back to work, starting to live their lives. It truly was a miraculous time. But by 2000, it was very clear that we had an enormous problem. 5% of the people living with HIV in Africa had access to care. 95% of people on therapy were in the first world. And the Durban Conference was really where the world understood that that was morally reprehensible and morally unacceptable, and that we were going to have to really begin to commit as a global community seriously to the provision of antiretroviral therapy where people needed it in the poorest countries and among the poorest of the poor. It is an extraordinary achievement that we have gotten now to over 12 million people on antiviral therapy. South Africa, the country we're going to, has more people on antiviral therapy than any other country in the world. That is one of the reasons why we're going there. But we're only halfway there. We still have, actually the majority of people living with HIV in 2014 are not on treatment. So we have an enormous effort ahead of us. We think that coming back to Durban after what will be 16 years since the last conference in Africa is really a historical opportunity to close that treatment gap, to renew the world's commitment to full access. And the great news from science, many of it presented at this conference, that we really now are understanding is that treatment is also prevention. So closing that treatment gap and getting the remaining people living with HIV access to treatment and care in safety and dignity and in ways that support their human rights also prevents new infections and really is the light at the end of the tunnel. I'm delighted to say that one of the reasons that I have for real optimism about the future is that my co-chair, who Owen will introduce, is my great friend and colleague, Dr. Olive Shoshana. And Olive, I have to share with you, will be the first woman from Africa ever to chair an international AIDS conference. That's an applause line. Don't you want to applaud? It's probably too late in coming, but nevertheless, we got there. Let me also say that I'm delighted to announce, some of you will have seen the press conference, that we are continuing with the same treasurer for the International AIDS Society, Professor Anton Pozniak from the UK, and we have announced at this conference the next incoming president-elect who will succeed me and take over the presidency at the Durban AIDS Conference, and that is Professor Linda Gale Becker from the University of Cape Town in Cape Town, South Africa, and the Desmond Tutu HIV Research Foundation. And Linda Gale is a physician, a clinician, a leader in HIV prevention research and also in adolescent research. And one of the things I think that is going to make Durban critically important and special for us, and it's something that we really all have in our minds, is that this is the place in the province, KwaZulu-Natal, with the highest HIV rate among women, and particularly among young women, of anywhere in the world. And we have always had a tradition with the International AIDS Society that we try to put the conferences in places where it will make a difference. And we really hope that we're going to be able to make a difference in that epidemic. 2 years ago, when we gathered in Washington, D.C., people may have thought that we were in Washington, D.C. because it's the political capital of the United States, and it is a wonderful city. But actually, when we were debating where to go in the United States, we all agreed we should go to the city with the highest HIV rate. And that, unfortunately, was Washington, D.C. Durban is ground zero for women in HIV, and that's why we feel that it's so critically important to be there. So thank you for your attention, and I hope some of you will be able to join us.
The floor now to Olive Shoshana. Olive is an absolute powerhouse in the response to HIV in South Africa. Someone who, no matter where you go in South Africa and look at how the country has responded to the epidemic, you see her handprint very firmly. So Olive Shoshana is the Chief Executive Officer of the South African Human Sciences Research Council. Dr. Shoshana is a public health professional and brings to her task a wealth of research, management, and policy development experience. Her vast local and international experience has been instrumental in her expansive career spanning over 30 years. Olive.
Thanks very much. Good afternoon. As Chris said, it will be 16 years since the Durban AIDS Conference was held by the International AIDS Society. And some of you might remember that at that conference, there were still major debates about whether HIV causes AIDS. That's what the debate was. There was another major debate as to whether should Africans actually get antiretroviral therapy, or should they just continue to prevent and not get treatment, because people were concerned that drugs brought to Africa may round trip to Europe and therefore reduce the cost and the prices of drugs. Those were the debates that were going on at the time. There was also a debate as to whether should we provide nevirapine to reduce mother-to-child transmission. It was so wonderful when Mr. Mandela came at the end of the conference to close it, to begin to say, we are going to address HIV in reality. We are going to make sure that people in South Africa get treatment. And everyone was very excited. And that changed the course of HIV management in Africa. It did, and since then, we've seen a lot of progress. We've seen, as Chris has indicated, access to antiretroviral therapy increasing dramatically in Africa. In fact, if you look at the figures, you'll see that we've got about 9 million people that have been saved, 9 million lives that have been saved in sub-Saharan Africa as a result of provision of antiretroviral therapy. We have seen universal rollout of antiretroviral therapy in Botswana, Namibia, Rwanda, Swaziland, and Zambia. In other words, more than 80% of the population of people living with HIV and AIDS in those countries are able to access antiretroviral therapy. With the advent of antiretroviral therapy and the rollout of antiretroviral therapy to a population, we've been able to decrease 25% of new infections in Africa, if you look at the decade that ended in 2011, and that is remarkable. We've been able to reduce 32% of deaths between 2005 and 2011. That is remarkable for a continent that is actually struggling, that's poor, that has got many major problems, but is being able to improve the lives of the people. Prevention of mother-to-child transmission has actually decreased new infections, by around 24% between 2009 and 2011. We still have a lot to do in Africa. And the big thing that we need to do is to make sure we roll it out even further in order to reduce new infections as well as to reduce mortality. But the other thing that we need to work on in Africa is the question of discrimination, especially against men who have sex with men. Many African governments are really treating people who are living with HIV and AIDS, and people who have men who have sex with men are treated so badly in Africa that we need to do something about it. They are even tightening the regulations and making it very difficult to be able to leave people who have sex with men who have sex with men to actually get treatment, to get care, to even decide to have sex with another man. Why should we in Africa be deciding for people choices in terms of sexual orientation? This should make us all very angry. We should work very hard as we go towards the conference in South Africa to address this problem. It is a problem that's plaguing our continent, and we need to work very hard to make sure we end the discrimination against men who have sex with men. We must end the discrimination against sex workers. We must end the discrimination against people who take drugs for recreational purposes. We should, because if we don't do that, I don't think we're going to be able to manage this epidemic. We mustn't treat people that have special needs as separate people. We must treat them as ordinary people. They are human beings, like all of us. They just have preferences that certain people decide not to agree with. And this is what we're going to work hard towards as we plan our conference in South Africa. Thank you very much.
Thank you, Olive, and thank you, everyone, for your comments. We have a few minutes for questions. If you just want to come to a microphone, and then we'll just say your name and your media outlet. Thank you. I think we've got our first one back there.
Thank you. Richard Ingham from the French news agency Agence France-Presse. I'd like to address this question to Chris Bara and also Olive Chisana about relationships with Russia. The IAS issued a statement this morning. There's been a bit of a spat with Russia about attendance at the conference and about the presentation yesterday on Eastern Europe. Are you at all worried that this is a bad sign for the future? What are you going to do to try and fix things up?
Well, thank you for that question. And just to let people know, the IAS statement and the issue that's arisen, we organized, the Conference Coordinating Committee organized a special regional session on Eastern Europe and Central Asia, very much because we are indeed so concerned about the expanding HIV epidemic in that region. The Eastern European, Central Asian region, including Russia and Ukraine, is one of only 2 regions in the world where the HIV epidemic is currently expanding and rates of new infection are rising. So, of course, we are profoundly concerned, both as scientists and public health people, but also just as human beings. We invited the head of the Russian Federal AIDS Agency, Professor Vadim Prokrovsky, who is the longtime leader of that program, to join us in organizing the session and also to present as a speaker, which he accepted. About 10 days before the conference, he let us know that he was not going to be attending, and we immediately requested from him if he would be willing a statement, a text that we could share with the audience. We really wanted to ensure that there was Russian federal government participation in this session. He declined that offer, and then on the day of the session, the Russians released a statement basically putting forward that they found that it was unacceptable that they were excluded. They were not excluded. We did our very best to include them. I think, this is, to me, rather, an unfortunate incident, but it is an example of a trend that we indeed are more concerned about, which is that we think it's critically important that Russian scientists, Russian clinicians, Russian people living with HIV in the community are able to access the international community, are able to participate, are part of our global response to HIV. And we have a number of initiatives working on that. We have, as a member of our governing council, Professor Sergei Dvoryak, who is a Ukrainian physician and a leader in his country, and he has really been our point person for this. Unfortunately, Sergei was not able to attend the conference because of the closure of Ukrainian airspace due to the MH17 disaster, so he wasn't here to participate. But we certainly continue to engage him, and we are now planning, in fact, an engagement around particularly the Code of Conduct for Health Professionals that we released at this conference, and we will probably do an IAS event with our partners, UNAIDS and others, in the region in the coming 3 to 6 months, and we really feel that engagement there is critical for the response and for us.
Perhaps I could just add in terms of how we can find a way to bring Russia to participate in this. I serve in another committee as a chair of the BRICS think tank, and one of the things that we're doing is actually developing a vision and strategy for BRICS over the next 20 years. And I chair a section on one of those pillars, one of the key 5 pillars on social justice and inequality, and where I work closely with colleagues, from Russia, from Brazil, from India, and China, and South Africa. And we will ensure that we do have a session, a satellite session. We would like to get a satellite session of the BRICS countries, and we'll be able to bring the Russians to come in and work with us on this conference. That will be my contribution to that.
Great, thank you. We'll take our next question over here.
Can I just add something quickly to that?
Sure, please.
I don't know if this is quite to the point of your question, but something to follow on what Olive and Chris have said. When St. Petersburg and Russia introduced their homophobic laws, we had a very serious question in this city because our sister city is St. Petersburg. Should we terminate that relationship with St. Petersburg as a protest against discrimination in that country, or should we continue to engage? And it was a very difficult discussion inside my council. The members of the GLBTIQ community in St. Petersburg made it directly and personally known to me that they did not wish us to terminate that relationship, that they wished us to use every endeavour to continue to engage, and that's what we have done.
Great, thank you. There's a question over here.
Jan Eppelans, Dutch National Radio. There are several figures floating around about amount of people using on ARVs at the moment. 10 million, Cooper said. 13 million, the last statement in Geneva from the WHO. 14 million this morning. So what is it? A few million more or less is maybe not an important.
I might answer that because in the WHO UNAIDS report closing the gap, 13 million in 2013, but the current figures are 14 million by July 2014.
Thank you for that clarification. There's a question here.
Hello, my name is Christiana with the German press agency, and I have a question to Professor Shisana. You were talking about your big efforts to stop discrimination in Africa. I wonder whether you can share with us some ideas of how you want to do that, because it's all very well to denounce discrimination, but what is your influence on governments in Africa to change their laws?
Okay. As part and parcel of our efforts to deal with HIV across Africa, we do have an organization called the Social Aspects of HIV/AIDS Reliance, which works with scientists and NGOs across the whole continent. What we'd like to do is encourage Sahara to bring key policymakers to the Durban conference and make sure we've got a leadership summit where we are going to get these leaders to have a discussion with them and explain to them the impact of the policies that they are putting forward with regard to men who have sex with men. So by working with them for the coming 2 years, working with those policymakers across the whole of Africa, and when I talk about the whole of Africa, I'm talking about the AIDS councils across Africa that are dealing with HIV and are the ones that are advising their own governments. We would like to work with them. Hopefully we should be able to get a better message coming to Durban.
Great, thank you. Any other questions? Great, thank you for your time today. We look forward to seeing you at this